Channel 4, presenting We Know Best.
Welcome to We Know Best. My name's Alexandra Granda. I'm going to be the hostess today. We're going to take your questions and concern on prenatal screening questions you might have. Now I'm going to have specialists here helping me answer these. Feel free to email me or call with your questions. Before we get into the first, second, and third trimester prenatal screening, let's talk about general tests that every pregnant woman is going to need to take. Blood tests, urine samples, ultrasounds. Now, the blood test is going to assess the blood type, Rh factor, glucose, iron, hemoglobin, assess the immunity to rubella, sexually transmitted diseases, toxoplasma infections, and diagnose certain genetic diseases you might have. Through this whole show, we're going to be discussing these things. When we come back from commercial, we'll get started. Thank you.
Woo! Bring 'em out, bring 'em out, bring 'em out, bring 'em out. It's hard to yell when...
Welcome back to We Know Best. I'm here with a nurse specialist, Nurse Fernandez, who is a specialist in first trimester prenatal screening. Over the commercial break, I've gotten a flood of emails with questions and concerns you might have. Let's get to them. Joanna from Illinois is wondering, what is CVS? What is a prenatal screening CVS?
Well, CVS stands for chorionic villus sample and is a prenatal test that is used to detect birth defects, genetic disease, and other problems.
Now tell me, is this test routine?
It is not routine, but it could be recommended.
It could be recommended. And is it invasive?
Yes, it's invasive.
And what's the risk?
It has risk for miscarriage and infection.
Interesting. Let's go to Maria from Miami, a local. She's wondering, her previous child was diagnosed with Down syndrome. She's very worried. Is there a prenatal test for a Down syndrome child?
Screening for Down syndrome is offered as a routine part of prenatal care. Screening tests use blood samples and ultrasound measurements to assess your baby's chances of having certain chromosomal problems, including Down syndrome.
Wow, that sounds good. Is this invasive or non-invasive?
No, they are not invasive, so they don't pose any risk to you or your baby.
That's great. Our next guest is going to be a second trimester specialist. We're going to be back after the break. Thank you.
My mind's telling me no. But my body's telling me yeah.
Welcome back to We Know Best. I'm here with a second trimester nurse specialist, Rocio. Let's get down to the questions and concerns. Rocio, can you please tell me what is alpha-fetoprotein?
Yes, it's actually a blood test that tests for high levels indicate that the baby might have a neurotube defect such as spina bifida, and low levels will indicate that the baby might have Down syndrome.
Wow, that sounds serious. And is it invasive or non-invasive?
Not at all. It's just a blood test.
Okay, that's great. And what about an amniocentesis?
It's actually detecting also chromosomal abnormalities such as neurotube defects and genetic disorders.
Okay, and the pub test is kind of similar to that, right?
It is. It's actually blood is drawn directly from the umbilical cord, and it tests for fetal abnormalities as well.
Okay. All right. And I have Caroline from Washington wants to know, what is a quad test? That sounds like several tests.
It actually is. It's 4 different tests. It tests for alpha-fetoprotein, the human chorionic gonadotropin, estriol, and the inhibin A protein.
Okay, and that is somewhat similar to the triple screen test?
It actually is. It includes all of them except the inhibin A protein.
Wow, you've been a great help. Thank you for answering these questions. Now, I'm going to go on commercial. We'll be back next.
Strumming my pain with his fingers.
Welcome back to We Know Best. Over the break, I've gotten a lot of emails on third trimester prenatal screening. Let's get to it. Okay. First, we have the biophysical profile. This combines an ultrasound with a non-stress test. It is done with a pregnancy is considered high risk, or there's questions about the baby's health. It looks at 5 fetal attributes: breathing, movement, muscle tone, heart rate, and amniotic fluid. Next, we have the non-stress test, which is also non-invasive, which has it doesn't say that it has any risk. What this does, it monitors reactivity and measures the heart rate of the fetus in response to its own movements. GBS, Group B strep infection, is a bacterial infection that the mother could pass to the child. So the GBS is recommended routine screening, and if the woman comes out positive, she's gonna have to take antibiotics before delivery. If the GBS is not screened, the baby could be at risk for meningitis, sepsis, pneumonia, and result in stillbirth. The glucose tolerance screening and glucose tolerance test is very important. It's a standard test to perform early in the 3rd trimester, and it monitors for gestational diabetes. As you can see, all these tests and screenings are very important. It's up to you to monitor yourself and come in with these questions and answers that you have. I'll see you tomorrow, and thank you on We Know Best.
The girl them skill arty. Thunderball. Some give it to, some give it to, some give it to our girls. 5,040,000 naughty shorty. Baby girl, all my girls, all my girls. Thunderball.